afternoon, everyone. Welcome to Stanford Medicine Women's Health Lunch. While there's actually no lunch, that's okay. We're still preserving the opportunity to come together, a broad audience, not only from the San Francisco Bay Area, but also around the globe. We certainly value your time and hope that you leave today feeling it was time well spent. We also appreciate that many of you have sent us questions in advance, as well as sharing your struggles and embraceable moments during the past year. And what a year it's been. I'm Andra Blomkalns, Professor and Chair of the Department of Emergency Medicine, coming to you today from Stanford Hospital in Palo Alto, California. While we're coming to you live, please know we're adhering to social distancing protocols. Some of our speakers will be joining us by Zoom, while others are here and more than 6 feet apart. So 1 year ago today, 8 San Francisco Bay counties were ordered to shelter in place. That required 9 million people to stay at home. At the same time, COVID was almost casually walking through the doors of our hospital, and nothing has been the same since. Some days we've thrived, other days we've barely survived. We've adjusted, found our strengths, and we're moving forward with hope. Lots and lots of hope. Shortly after this time last year, the first ray of hope came for me with the development of a test. We went from this ghost of a disease to something we could actually find. That was further surmounted when a semi-truck arrived in the loading dock with the first doses of vaccine. Today, we're joined by 4 incredible Stanford women, physicians, researchers, scientists, who, like all of us, are also moms, wives, daughters, partners, and colleagues. Maybe it comes as a surprise to you, but all of them, just as all of you, have struggled with the impact of COVID-19 on a daily basis. These women leaders will provide some insights on several things: taking care of ourselves and our families, information on the vaccine from efficacy and what lies ahead, and also a little inspiration that can help us recharge for the year. As difficult as the past year have been, many of you have discovered ways to recharge. And when you registered, we asked you the following question: what is the one positive change from shelter in place that surprised you? Maybe even one you intend to keep. And this is what you told us. Many of you acknowledge that life has slowed down in a good way. We're resting more, reading more, and even exercising and eating better. Whether it's time by yourself, with your family, with your friends, with your partner, or even your dog or spirit companion, making time for those who are truly important was the answer we most heard. We're reconnecting with individuals we care about in our lives, while at the same time shifting very important priorities. As one of you told us, it's no longer important to be in a race with keeping up with the Joneses. So with those insights in mind, I would like to introduce to you Dr. Deborah Kaysen, Professor of Psychiatry and Behavioral Sciences here at Stanford. She will share with us how shifting thoughts with a flexible mindset can help us move forward from surviving to thriving during this challenging time. She is joining us today by Zoom. Dr. Kaysen, welcome.
Thank you so much. Thank you for that lovely introduction. And thank you for inviting me. This is an honor to speak with you all. As you were talking about, this year has been a challenge for most, if not all of us. For some of us, it's been an exacerbation of existing stressors, whether it's around economics, health concerns, parenting, caretaking, or work. For others, it was a whole new slew of challenges. Women in particular have borne a large portion of the burden of these stressors due to uneven distribution of parenting responsibilities and caretaking, and the fact that women are more vulnerable economically. So, for example, the types of positions that have been eliminated during the pandemic fallen disproportionately upon women. For some of us, we've experienced stressors from the pandemic, but others have experienced traumatic events like having someone we love die of COVID, becoming seriously ill ourselves, or having jobs where we are managing unprecedented numbers of sick or dying individuals. Understandably, these types of events have led to reactions for many of us like anxiety, sleeping problems, grief, sadness, or traumatic stress responses. So, for example, if we look at rates of depression before and during COVID among individuals in the United States, about 10% of women reported depressive symptoms prior to COVID, and about a third reported depressive symptoms during the initial months after COVID. And women, perhaps because of our roles as caretakers, do appear to be more at risk for these types of responses than men. Now, it's important to note that these are normal responses to coping with this level of stressors, so they're not psychopathology. You can think about it almost like a burden in your bag. As the weight of the burdens go up, it makes it more likely that you'll have these reactions in the same way that carrying a heavy bag or backpack is going to make your back hurt. Now, it can be easy with this backdrop to lose hope and to feel like these reactions won't end. Even though this is a difficult time, for many people, these initial and normal responses to a severe stressor will improve over time because people generally are resilient. So let me tell you what I mean by that. Resilience is the process of adapting well in the face of adversity, trauma, or tragedy, like what many of us have been coping with this year. Being resilient does not mean that a person doesn't experience difficulty or distress. Emotional pain and sadness are common in people who've suffered major adversity or trauma in their lives. And I would say that they are normal responses to an injury. What resilience is it's the ability to bounce back from those difficult experiences, like grass gradually springing back up when we've stepped on it. Sometimes when we think about resilience, we talk about those people like they are somehow extraordinary. But actually, when we look at research around resilience, what we find is that it is ordinary. It's not a trait that people either have or don't have. Instead, it involves behaviors, thoughts, and actions that can be learned and developed in anyone. So much of my own work is focused on teaching people ways to shift the meaning they make about events in ways that may be less rigid, may be more helpful, and are more likely to promote resilience and healing. For example, much of my own research and clinical work is in the treatment of traumatic stress. One of my projects has involved testing brief psychotherapies to reduce PTSD, anxiety, and depression, and to improve overall functioning among sexual assault survivors in the Democratic Republic of Congo. This is a region where there are few mental health resources available and where there are continued high rates of sexual violence. In that work, first we found that brief cognitive therapies reduced symptoms tremendously among the women who received care. Most of the women lost their diagnoses of PTSD or depression. Second, we found that years after treatment, for most of the women, they maintained the improvements from treatment. What that means is that when we learn new thinking habits, they stay with us. Many of these women continue to experience severe stressors, but the skills they learned help them to be more resilient. Last, we compared the sites with higher levels of ongoing violence and trauma during the trial with those with lower levels. We had sites where there was ongoing violence throughout the project. What we found was that women's symptoms improved over the course of a cognitive therapy, even in those communities with high levels of ongoing violence. Well, why is that relevant here and now? We are in a time of stress and uncertainty, but these findings suggest that with the right tools, we too can reduce distress and promote resilience. There is always hope. So how can we use these tools here and now to cope and to move from surviving to thriving? Well, one strategy is to look at our thoughts. The first step of this strategy is to identify the thoughts you've been telling yourself. Often these thoughts can be quite quick, and we don't even notice what we're telling ourselves. But instead, look at the story you're telling yourself about what's happening and why. What feelings come up with you for that story or that way of making sense of the situation? Now ask yourself, is the story accurate? Is it realistic? What are you leaving out? Ask yourself, what would you tell a dear friend about the situation? What would your kindest self say about it? Notice if a new thought emerges. Is it more accurate, more flexible, more forgiving? Often we are so much more gracious with our friends and our loved ones than we are with ourselves. When you come up with a more flexible, potentially more realistic thought, practice it and notice the change in your emotions. Notice the change in your body. You can almost think about it like mental yoga. By helping increase flexibility and range of motion in your thinking, it can decrease pain and suffering. Now, this isn't about denying the hard truths or the difficulties we faced, but it also makes space to look at the other pieces of the story, the pieces we may be leaving out. Now, the other suggestion I would add is to look at how we're living our lives in this moment. What we do also influences how we feel. And when we get more stressed, we often withdraw or stop doing things we value. By building those activities back in, even if we have to do it flexibly and creatively right now, it can improve our mood and foster resilience. So I'll give you a personal example. I recently got back into horseback riding. It's an activity that brings me joy. But when I first got back, I noticed I was really rusty. I noticed how well everybody else was riding. I wasn't used to being a beginner again. And then this increased feelings of anxiety for me. So I had to ask myself those same questions. I've learned hard things before. We don't have to be perfect. If it was my friend, I would encourage them to stick with it. And I would help them notice the things that they do well, even if they're small things, which helped me refine my joy in the activity. So one last thought, there's a barrier often for us as women in using these tools, whether it's shifting our thoughts or building activities that bring us joy, which is that often as women, we prioritize others' needs over our own. So let me give you an example that may resonate with many of the women in the room. If someone's cooking breakfast and we burn the toast, or they burn the toast, who tends to eat the burnt toast? I know in my household, it's usually me. I don't like to waste things. And I know my family doesn't like burnt toast, although I don't like burnt toast either. But as women who are often taught to put others first consistently, we are often the ones to take the metaphorical burnt toast, and we all deserve better. So these are some ways to think about thriving, even in stressful environments. And so now let me turn it over back to you, Dr. Blomkalns.
Thank you so much, Dr. Kaysen. I'll have to say that your metaphor of burnt toast really resonates with me. I'll have to admit also that the flexible mindset you're speaking of sometimes is not easy, particularly with the daily barrage of challenges we've all endured over the last year. These challenges have forced us to move out of our comfort zone. Last year, I moved my 80-year-old parents from New Orleans to Palo Alto years before I expected to do that. And as you might imagine, that required all of us, including my dog Sansa, to shift to a more flexible mindset. So talking about family, this brings me now to our second guest, Stanford Clinical Professor of Psychiatry and Behavioral Sciences, and also Department Wellbeing Director, Dr. Grace Gengoux. You heard that right, Wellbeing Director. I'm sure many of us have taken on that role for family and friends, and even our colleagues over the last year. So this begs the question, who's looking out for our well-being? Welcome, Dr. Gengoux, and let's take a few minutes to focus on families and the types of things women in our audience can do to help their families cope, while at the same time keeping balance in their own lives. To start off, what would you say is the most important thing as we help our families navigate the realities of the pandemic?
Yeah, ironically, the most important thing we can do to help our families is to take good care of ourselves. I mean, if I had one message for the women and men in the audience today, it would be that you matter, and we need to legitimize our own needs and make sure we're taking care of ourselves in order to take care of the people that we love. I like to think of it actually like charging up a cell phone battery. You know, you do things on a daily basis that reliably just deplete your energy. They drain your batteries, and so we have to be sure that we're plugging back in and charging our batteries back up. So the better you know yourself, the better you know what kinds of things will charge up your batteries. And then you can plan to be able to do that, to plug in and recharge so that you can actually do the hard things that are being asked of you.
Okay. We hear a lot about self-care, but actually it's really difficult at this time to explore activities both within the workplace and outside the workplace. All of us are trying to juggle those things. Do you have any practical advice about that?
Yeah, the first thing I would say is we have to acknowledge our actual realities. Like if you've got kids and they're distance learning or they're in 2 hours of school a couple days a week, that's your reality. If you are in a family where somebody has a very demanding job, or maybe somebody lost a job or lost their livelihood, or maybe you're in a family where maybe yourself or someone you care about is having a lot of medical illness, or maybe there was grief or loss in your family recently. The truth is, the better that we confront and acknowledge and accept what we're actually dealing with, the better we can cope. And so before the pandemic, I used to think about resilience like a recipe, like each person has their own set of ingredients that kind of go together to make their signature dish, their own personal recipe for resilience. And I think that recipe analogy still applies. It's just right now, it's like you can't go to the grocery store. You have to make your recipe with whatever you already have in the pantry, so to speak. So we're all forced to get creative and figure out, if I think exercise is important for my recipe, but I can't go to the gym, I need a new plan. If connecting with my loved ones or travel is really important for my resilience, but I can't do all those things, I need a new plan to get that same boost to my energy.
Great. Many of us have children, and we're very worried about how they're doing with the pandemic. Can you tell us how we can help our children thrive under these circumstances?
Yeah. So kids and teens need different things depending on their age, but kids at all ages and teens need a couple of things I'll speak to. So number one, they need loving adults to pay attention to them. And they also need age-appropriate opportunities for independence. So we have to listen to our kids. We have to understand how they're doing, check in with them, and remember that our kids are watching us. They're learning about how to cope with this by watching us, and we need to think about what we want to teach them. I want to teach my kids that sometimes things are hard, and it's okay to feel bad when things are bad. But then you have to do the things that bring you joy and help other people, and those are the things that make us feel bad when things are tough. Also, we have to help our kids cultivate leisure activities, particularly leisure activities away from a screen or an electronic device, right? So we need to look for things that our kids, maybe they used to enjoy, but help them access them in a new way, or, spend extra time. I'm thinking like of a kid who likes to cook, help them find a new recipe. A kid who likes to play sports, help them learn how to use some new equipment. A kid who likes to build things, help them learn how to use a new tool. The truth is, those tips work for adults too. If we really focus on the things that we enjoy, even when times are hard, then we'll have it's like training our minds to focus on the positive actually makes the biggest difference when we are suffering.
Thank you. For women in professional roles, how might we think about integrating meaningful work with personal priorities, like taking care of our families and ourselves?
Yeah, this is hard. We know from research that women take on a disproportionate amount of household work, even when there are multiple adults in the home working from home. And so we have to, number one, maybe lower our perfectionistic expectations for ourselves and accept help or ask for help, but especially accept help when we can. And then it's, another thing that is a benefit maybe of having limited time. When we feel like we have really limited time, it forces us to focus on the things that matter. So I see women in my workplace having an even bigger impact than before because they're so focused on the things that bring meaning and the things that they really value. And I think if we're going to learn one thing from this difficult set of circumstances, it could be that we always have a limited amount of time. And the better that we focus on the things we really care about, the better impact we can have.
Okay. Thank you so much for sharing those insights. I'm struck by how important the delicate balance of work, family, and ourselves can be. I'd like to share that there was a significant looming obstacle for my team in the emergency department. As frontline providers, we were even frightened to go to work. And how can we keep ourselves safe while at work? And we learned so much during that time. And COVID was everywhere. And how do we keep ourselves and family safe when going home? It was a real struggle. So balancing all these shifting priorities, trying to keep on top of the daily changes of information, it can be difficult for women to find meaning in their work activities or their activities outside of the home. Which brings us to our next guest, Dr. Helen Blau. She is a role model for many women and a scientific pioneer in the field of stem cell biology and regenerative medicine. We are thrilled she's joining us here to share some of her recent groundbreaking discoveries in the area of rejuvenating cells to combat aging. I'd like to think of that as a real-life look at the fountain of youth. Dr. Blau is bold, determined, creative, and a risk taker in a historically male-dominated arena. She is not shy when she speaks to the dilemma of juggling science and family, and yes, it is a dilemma. Dr. Blau is joining us via Zoom. Welcome, Dr. Blau. Dr. Blau, I think you might be on mute.
Thank you so much for that introduction. I'm really pleased to talk to you today. Carla asked me to tell you what excites me and drives me to work really hard in spite of COVID. When I left work exactly a year ago, I never thought I would be home 12 months later. So what has kept me going? I love the process of learning, of discovery. I love teaching and interacting with students and postdocs from around the world with different backgrounds. If you put an engineer near a biologist and an artificial intelligence expert, things happen. They look at things in new ways. They merge their expertise and discoveries are made. It's magical and exciting. But it's been a huge adaptation since COVID, being home 24/7 and interacting with people, collaborators, students, trainees, primarily on my computer, by email and by Zoom, with everybody in their little boxes on a screen in 2D. At first, I was pretty disoriented, not being able to go to work. Then I thought about what cells do. They adapt to their environment and they express different genes. I found that out early in my career. When I was an assistant professor at Stanford, the dogma was that a specialized state of a cell was fixed and irreversible. I wanted to know whether cells could change. The dogma was that once a liver cell, always a liver cell. And I had a hard time accepting that, probably because of my upbringing. I was born in England, and I grew up in Germany and France, and I went to university at York in England before coming to the States for grad school. So I adapted to different countries and cultures, languages, tastes in food, behaviors. So I thought if I could change, maybe a cell could too. Why couldn't it? So I exposed liver cells and skin cells to a muscle environment using a cell fusion method. And lo and behold, I found they could turn on genes that they were never supposed to turn on. They could turn on muscle genes. They changed in response to their environment. So during this time of COVID, I guess one of the keys to my success was focusing on what I could do, not on what I couldn't do. So I worked with my lab members from afar to write one of the most important papers of my career. We asked, can we turn back the clock on aging? Can we rejuvenate a tissue? And we focused on my favorite tissue, muscle. And this is really important because as you age, you get progressively weaker. In fact, after the age of 50, you lose 10 to 15% of your muscle mass and strength per decade. That's a lot. And muscle weakness leads to immobilization and inability to take care of oneself, which leads to institutionalization and frailty that can lead to early death. So it would be really neat if you could disrupt this downhill trajectory. And what we discovered is a pivotal mechanism, a pivotal molecule, a master regulator of muscle aging. If it's overexpressed in the muscles of young mice, they shrink and weaken within a few weeks. And if we block its function in the muscles of aged mice, geriatric mice, they increase their muscle mass and strength by 10 to 15% in 1 month. So that's pretty exciting and really unexpected. We discovered this molecule in a search for regulators that could activate muscle stem cells. We thought that maybe the stem cells would be exquisitely sensitive to inflammatory signals, since inflammation is one of the first things that happens after an injury. And lo and behold, that's what we discovered, a new role for prostaglandin E2, an inflammatory metabolite. And we found that tweaking its levels just twofold back to those present in a young individual rejuvenates the aged muscle and enhances regeneration and repair of muscle damage. So Carla asked me also to talk about my personal life, summarize my whole life in 10 minutes. And so that's what I'm going to try and do. So I'm married to David Spiegel. We met at Harvard. I was attracted to him because he spoke French and he played a wicked guitar. And we formed a folk music group and called ourselves Free Energy, or Delta G, because we played for $25 and drinks at the No Name and the Idler in Harvard Square. David is a psychiatrist, and he's also on the faculty at Stanford. And he teaches self-hypnosis to deal with stress and pain and anxiety and smoking. So we like to say that between us, we've got it covered. I take care of the body and he takes care of the mind. And we have 2 children. That sounds easy, but it wasn't. When I joined the faculty at Stanford, there were no women in basic science in the medical school with tenure who had children. It was pretty clear that people considered it an either-or choice, career in science or have children. I just couldn't give up either. So I decided to muddle through, and it wasn't easy. I took 4 weeks off when I had my first baby. When I came back to work, my chairman checked up on me every morning to make sure that I was in. And interestingly, the wife of a professor next door to me had a baby around the same time, and he was considered a hero for staying home mornings every day of the week. Nobody seemed to notice the double standard except me. So I am really glad that things have changed so much, and that it's pretty much taken for granted that women scientists can and will have children and succeed, and that taking 3 to 6 months off for maternity leave is necessary and routine. That's a great advance. So women still do worry about the impact of working and what that will do to their kids. And I worried about that a lot. I couldn't stop doing it. It was my passion. I love both. The children gave me a break from the lab, and their joy of life and love of adventure fueled me. And I think they admired me for caring about my work. And I think they still do. In fact, they're doing pretty much the same juggling act as I did. My daughter, Julia, is a lawyer, and she's championing the rights of immigrants for food stamps and healthcare. And my son, Dan, is an architect who not only designs homes, but also public spaces. And his wife, Meg, designed the landscape for the window of our meditation center that you see behind me. And my son-in-law, Eric, is a CEO of a biotech, which recently pivoted from doing DNA tracing of organic foods to detecting COVID in ventilation systems. And I have 4 grandchildren, all under the age of 6, and all in the Bay Area. So I feel really lucky about that. They bring me so much joy. Even the 1.5-year-old grandson is helping with a big grin. He's always grabbing a huge broom and a dustpan and sweeping things around the house. I also really enjoy my scientific children. I get tremendous satisfaction from helping them learn to become independent thinkers, good writers, and speakers. And most have gone on to successful careers in academia or industry. And I stay in touch with them, especially when I travel to meetings. So for David and me, adapting during COVID has meant seeing our kids more, seeing our grandkids more. Since we're not traveling, we usually travel once a month. And we've also gotten to do adventurous cooking, octopus and squid and duck and lamb chops, and prepared in different ways, which we never did before. And part of this is because we no longer do grocery shopping. That's something that I never want to do again. Instead, I cruise the stores online and find exotic new things to try and get Instacart to deliver them. And so that's been a wonderful change. We also take a day each weekend to explore a new part of the Bay Area, biking or hiking. And that's been exhilarating, especially since there's less traffic and it's much easier to get to places. And we spend a day a week with the grandchildren and really get to know them. So as you probably gathered, I love challenges. And so one of the things I spent a lot of time doing during COVID was starting a biotech. And it's based on the rejuvenation factor that we discovered. We've made a lot of old mice super strong in my lab, like little Schwarzenegger mice. And my dream is to translate that to people, not just mice, and make them stronger. And that would be so hugely rewarding to help people with genetic muscle wasting diseases or to help people as they get weaker with aging. If you are mobile for a few weeks when you are older due to disease or to an accident like a broken hip, your muscles atrophy so quickly. And your muscles atrophy so quickly, and it's really hard to get that strength back. I'm hoping that the drug we discovered that can block this pivotal aging enzyme can change that. So that's the passion that's driving me during my COVID days. This COVID period has really reinforced what I learned about cells. They change. I've found that there are ways to work productively, remotely, in a way I never imagined possible. And David and I realized that on this anniversary of the lockdown just a year ago, that we've spent 365 days together consecutively. That's the first time in our lives ever. And we love it. And we've had new adventures. And so we're not sure we want to return to that same old life that we had before. So life is all about adaptation, and good things can come even out of a crisis like COVID.
Wow, thank you, Dr. Blau. I'm hearing some common themes: flexibility, regeneration, adaptability, and Instacart, right? So our registrants have submitted a number of questions on stem cell therapies, and I look forward to hearing your perspectives in our upcoming Q&A. So from discoveries in science to our own discoveries this past year, before we move on to our next guest, I want to share with you the answers to the second question we asked you during registration. Shelter in place has given us time to pause and reflect. With that in mind, what is the one thing you no longer need in life and will happily discard? Here's what you've told us. It looks like we're happy to spend less time in the car commuting. We've smiled at relinquishing high heels, pantyhose, manicures, and hair color. So many of these things have just become priorities of the past. And also high on the list of discards, rushing, resentment, and notably those toxic relationships. They just don't seem that important anymore. My hope for all of you is that you can remember these insights as life begins to shift to a new normal. We will email you those word clouds so that you can stick them on your refrigerator or in your bedside drawer to serve as a visual reminder. So now let's move on to what we've discarded to what many of us are so eager to obtain, the coronavirus vaccine. Here to answer your questions is Dr. Grace Lee. She is Professor of Pediatrics and Associate Chief Medical Officer at Stanford Children's Health. She is also a member of the Center for Disease Control and Prevention's Advisory Committee on Immunization Practices. Dr. Lee, we are so happy to have you here, and we have several questions for you.
Thank you. It's a pleasure to be here.
So many people want to know, when will we all have the vaccine?
Soon enough. It's hard to be patient in this day and age, but we are very fortunate in the U.S. that the supply chain is now getting filled in, and we anticipate that we will have enough doses to vaccinate everyone who wants a vaccine, and then some. You know, I think that points to the fact that in the short term, we still have some allocation issues, but this is a matter of weeks, and we hope that in the next couple of months that everyone who wants a vaccine will be able to receive one.
Okay, thank you. Thank you for that. So what can we tell our viewers who are considering getting pregnant or who are already pregnant about the vaccine?
Yes, we've had many questions about this, and on the Advisory Committee on Immunization Practices, we wanted to recognize a couple of items. Number one, that we know pregnant women do have severe disease when they get COVID infection, and so we wanted to ensure that we had the ability to provide access to vaccination. As you know, we currently, the American College of Obstetrics and Gynecology, ACOG, has suggested and endorsed the idea that vaccines should be accessible to all women who wish to become pregnant or who are breastfeeding, in part because of the higher risk of severe outcomes associated with pregnancy, but also just because it would allow women the ability to get it. And I actually have been so amazed and impressed at the number of women who have chosen to become vaccinated early on in this pandemic. We have seen tens of thousands of women actually come forward and talk with their physician or their obstetric provider to ask questions about vaccines. What's the risks and what are the benefits to me? And to make the decision to go forward and get vaccinated in many instances. And we are actively tracking safety in pregnancy as a really important consideration. So for those who may not know, one of the systems out there is called vSafe. So anyone who gets a vaccine is welcome to join. It's a text messaging system that allows folks to have sort of a personalized approach to thinking about safety and to communicate what's going on with their responses to the vaccine directly to the CDC. And actually, because the response has been so robust overall in the U.S., and also because such a large number of pregnant women decided to get vaccinated, they've actually spun off a pregnancy-specific registry, which allows us to, again, monitor vaccines in pregnant women. And I will say, just as an aside, that we found that similar to the clinical trials, the local and systemic reactions are common, similar to non-pregnant people. And thus far, right now, the safety looks really reassuring, but we'll continue to monitor, and it's going to be important for us to continue to monitor both efficacy and safety going forward.
Thank you. It's very reassuring. So something I think about is, does the vaccine protect us against the variants?
Yes, so it's an evolving situation, as you can imagine. So I would say there are 3 excellent vaccines that we have available in the U.S., and we're very fortunate to have access to those vaccines, all with excellent efficacy. Some of the best data we've seen so far has come with the J&J vaccine approval or the Janssen vaccine, where they have actually tested efficacy in large-scale clinical trials in the UK, South Africa, and Brazil, where there are variants that are predominantly circulating, and found that the efficacy is very similar. We are looking forward to additional data for the mRNA vaccines that are currently available. As you may know, those were approved during a time when the variants were not circulating. And so CDC and others continue to do effectiveness studies to understand what is the impact of the variants in terms of understanding vaccine effectiveness, and also thinking about the durability of the immune response. So I would say right now, it's important for us to remain cautious and continue mitigation strategies to prevent the risk of transmission in the United States and globally. However, we are reassured right now that the vaccines appear to be effective against the variants, and we'll continue to monitor that over time.
Thank you. So how long will the vaccine last? Are we looking at getting it once a year, twice a year, 3 times a year?
So the durability of protection is something that we're going to continue to monitor. I would say that for the vaccines to date, it is looking very promising. However, we recognize that variants will emerge, not as quickly as we see with flu, but we do anticipate that as variants emerge, we may need to respond to that. And so thinking ahead, I do anticipate that probably we'll need some booster doses in future years. Hopefully not every year, but I certainly think that, the development's already proceeding to be able to address these variants, even though we have active vaccines that are currently effective in the U.S. And, this is not just a U.S. situation, it is a global situation. So we're going to continue to monitor not only what's circulating in the U.S. and globally, but we're going to have to, as you said, adapt and be nimble in order to be able to continue to respond to the ongoing pandemic.
Thank you. I think, as people get the vaccine, it's very emotional for them. They feel stronger when they come out. 2 weeks later, after the last vaccine, do we still have to wear a mask?
So a great question. This is going to be changing over the weeks and months. Yes, I would say today it continues to be really important for us to use every strategy we have in our toolkit to be able to mitigate the risk of transmission, and particularly with the variants that we have now circulating. That said, as a proportion of individuals who become vaccinated continues to grow over time, and we have a better sense of the circulating strains in the U.S., what I would say is If you ask me again next month, I might have a different answer, but I would say for today, it becomes really important for us to not only protect ourselves and mitigate the risk of transmission, but also just to remember that there is going to be a portion of the population, all of our children, who won't have a vaccine yet available, and we're going to want to make sure that we're able to protect them in addition to all of those who are adults who may or may not be able to get vaccinated for a variety of reasons.
Okay, great. That's a good segue to what are the potential long-term risks for children with a vaccine?
So so a couple of things. So I should note that the U.S. Has a really robust set of post-market safety surveillance systems that are run by our federal agencies. And we are very fortunate that since week one, literally 1 week after the first vaccine dose was administered in the U.S. on December 12th, that we were able to have the vaccine safety systems up and running and monitoring vaccine safety. Now, all of the vaccines that are available to date, the youngest age would be 16 years of age, and others are authorized for use for 18 and older. We do anticipate there will be some trials forthcoming, particularly in the teens, 12 and older, and we hope that data will come along soon. I know many of us have middle schoolers and high schoolers that we'd like to be able to offer the opportunity to vaccinate. So that will probably come along first. And there are trials down to in children aged as young as 6 months. So we anticipate the 6-month to 11-year-old clinical trials will come along soon. But yes, wow. And then I anticipate those vaccine safety studies will be important to have in the clinical trials and in the post-market safety surveillance systems.
Great, but that also means that people need to enroll in those trials, so that's going to be really important. Thank you so much, Dr. Lee.
Thank you.
All righty. Thank you, Dr. Lee, for this information. At this time, I want to bring our presenters together for a Q&A. So many of you have responded with a number of questions in advance. And we'll get started. The first question belongs to Dr. Grace Gengoux. All right. As we look ahead to easing lockdown restrictions and an increase in getting together and other types of events, what tips do you have for us to manage expectations of our own and our friends? And how do we keep from experiencing the fear of missing out or FOMO or for the invitations that we pass along?
Yeah, this is another place where knowing yourself and your own personality really helps. I think each of us can take the time right now to kind of reflect like we're doing today on what we've learned about ourselves over the last year and use that to inform how we make our plans going forward. So if you're someone who's really enjoyed having a little more downtime, really enjoyed maybe lots of time with your immediate family, you're going to want to find a way to build that in and not get so busy and so overextended again that you lose track of that really important connection. For someone who has enjoyed a more of an extroverted lifestyle, I'm sure it'll be a big relief to be able to get out and see lots of people again. But remembering to keep that balance, the things that that recharge us really count.
Thank you. Thank you so much. All righty. Deborah, what will be the long-lasting impacts of the pandemic in terms of mental health?
This is such an important issue. Based on what we've seen with other epidemics, other pandemics, and other types of stressors or traumatic events, we can think about wildfires or hurricanes. What we would expect is that for the majority of people who are distressed now, they'll improve. Right? The insomnia, the anxiety, the depression, as people get back into a more normal rhythm and the stressors decrease, most people will have those symptoms improve. There is going to be a subset where those symptoms may not get better. And that's a group that we should be thinking about what kinds of services they may need. So if you, for example, are noticing, let's say the stressors have gotten better and it's been 2-3 months and you're still feeling pretty depressed or you're still feeling really anxious, then it's time to reach out for some help. That may be talking to someone like myself or Grace. It might be, there are a number of coping apps that are out there. Some of them are free that can be quite helpful for people. It may be talking to a dear friend or someone in your spiritual community. There are lots of ways to heal, but I would look at that 2 to 3 month window to see how you're doing.
Thank you. Helen, your discoveries are incredible. When will those things be accessible to the rest of us? I think you're muted again. That's okay. We planned for that. No worries. Yes. Everyone has to do that during a meeting. So
It's now a proper Zoom meeting.
yeah, proper Zoom meeting. Yes.
Right. Now this is the real thing. Thank you. Yeah, that's the reason I formed a company, so that we could make human quality drug and test it. And we hope to be in clinical trials within a year or two. So those will be the first step. Of course, it's going to take a series of clinical trials before it's widely available, but we should know in the next couple of years how effective it is in people. Because, of course, not everything translates from mice to people, but we're pretty hopeful that this might.
All right. That's very reassuring. Okay. Grace, how exactly do the mRNA vaccines work? How are they different from the vaccines we might be used to? And are some of the vaccines different from the others, like Johnson & Johnson, and what should we be paying attention to?
Sure. So there are 2 mRNA vaccines that we have available in the U.S., the Pfizer and the Moderna vaccine. And the way I like to think about them is there are instructions for how to make the spike protein that are packaged in a little lipid package. And, it's important to remember that those instructions are challenging to deliver, hence the cold chain, needing to have ultra cold temperatures or freezer temperatures in order to be able to deliver those vaccines. Those instructions get delivered into the cell, and your cell starts to make that spike protein, and that's what teaches your immune system how to respond. Mm-hmm. So the adenovirus vector vaccines, it is another way to deliver instructions into the cell. It's a different layer. It's the step just before the mRNA. It delivers the instructions into the cell and teaches your cell, or teaches your immune system to respond to, again, the spike protein, and to be able to create antibodies and T-cell immune response. So your humoral and cellular immune response are incredibly important to provide you that protection. I just want to add briefly that it's really important to remember that this is a really safe way to develop immunity to infection, and a far safer way than getting COVID infection overall. So.
Oh, okay. Makes sense.
Yeah.
Great. Grace, how do we set healthy boundaries and consequences for our children during this time?
Yeah, I think that's a really a challenge that many parents are facing. One thing to keep in mind is that structure and routine and predictability do really help kids and teens. But actually, when we think about consequences, the truth is that a lot of negative consequences aren't really very good for kids, and especially when kids or teens are struggling with symptoms of depression or anxiety, having a lot of strict negative consequences is probably the wrong idea. So as parents, we're really looking for ways to sort of turn that on its head and figure out ways that we can offer positive consequences and positive experiences as a way to motivate our kids to do hard things, the hard things that are being asked of them, and to really get them motivated to do things that bring them joy. And that's what's going to help with the mood.
Okay. Makes a lot of sense. All right. Great. I have to wonder that, as women leaders, how do we continue leading in this environment? How can we inspire others and demonstrate leadership? And for me, I'll have to say that I think that showing some vulnerability, and it's saying it's okay to I have those same challenges. We all have those same challenges. We have the same questions, and we're trying to learn from each other and have the same approaches. I see people talking about new healthcare regimens, new recipes, and they're working out more, they're reading more, they're sleeping more, and I'm thinking to myself, I'm not doing any of that. Am I behind? Good grief. So I also think there's something to sort of mounting a group effort and resilience against the pandemic, and that's been very useful for the emergency department in particular, is that we know we have a job to do, and we know we have a job for the community, so we can take some solace and some comfort in that mission. So none of us has done this before, and we're all learning together and can benefit from recognizing that this is very much a community, team, state, country, and even global effort. Dr. Kaysen, the pandemic has been here over a year. What if we have not yet embraced some of your tips, like maybe me? And how far behind can people be in the curve, and can we catch up?
I want to highlight 2 points. I think, first of all, sometimes the talk about self-care can become yet another stick that we hit ourselves with, right? And so I want to caution people about that. I, too, have seen social media with some of my friends who are doing amazing jigsaw puzzles or who have taken on all kinds of fabulous new hobbies. I'm like, who are you people?
Right.
I don't have time for that. Right. And so it can be easy to get angry at ourselves about that versus really just accepting kind of where we are, setting small achievable goals based on our work demands, our family demands. What's one small thing you can pick up rather than having it be yet another thing that we feel like we're failing at. So that would be my first tip for you. You're carrying so much weight on your shoulders. We don't want this to be yet another piece, right? And that's true for so many of us, myself included. The other piece I would add is there is no such thing as it being too late, right? So unlike muscles where there might be a too late, and I'm thinking I need to start doing some more strength training. With these kinds of tips, it can help whenever you pick it up. With my own work and the wealth of data we have about treating PTSD, the average length of time it takes women to come in for treatment after sexual assault, for example, is about 15 years. And we can't turn back. And we can't turn back the clock. I can't get back those lost years or those lost milestones, but we can still help people reclaim their lives. And so for some people, they're racing as fast as they can right now. And when they have time to exhale, these kinds of tips and strategies will still be there waiting for them.
Fabulous. So there's hope.
There's always hope.
Always hope. Always hope. Lots of hope. Okay, Dr. Blau. We had a specific question regarding, is there any stem cell research with age-related macular degeneration?
Yeah, that's a good one. I think that's going to be one of the first successes that we're going to see in the clinic. So the retina is a light-sensitive nerve layer that is on the inner surface of the eye that relies on the integrity of the retinal pigment epithelium. And in macular degeneration, it's characterized by a loss of this RPE, retinal pigment epithelium, which leads to photoreceptor death. And as a result, you get wavy or patchy vision, which can lead to blindness. But in recent years, scientists have been taking pluripotent stem cells. These can be either embryonic stem cells or cells derived from your own body, cells that you get from the urine or blood, and you convert them with a set of transcription factors to pluripotent cells that are similar to embryonic stem cells, but they're not from the embryo, they're from you. And these can be converted into retinal pigment epithelial cells and then transplanted. They're grown on something like a contact lens and then transplanted into the eye. And in animals, they've restored vision. And right now there are clinical trials, early stage, phase 1 clinical trials, going on in the United States, the United Kingdom, Korea, Japan, many parts of the world. And they're looking very promising. So I think this is something that's going to be treatable by stem cells. It's pretty exciting.
Amazing. Dr. Lee, how now when we have some people who are vaccinated and a lot of people who aren't, how do we approach testing? Like when, how often, even where?
Thank you for the question. And again, this will be another issue that continues to evolve over time. But what I would say is, what's clear is if you're symptomatic, if you have symptoms that are potentially consistent with COVID, would still recommend very strongly getting tested. We also are certainly recommending people who have been exposed to ensure that they are also getting tested. And I think those two principles will continue to remain because they're just important principles that we carry for every infectious disease. I think the other question that has come up is really around population-based screening or surveillance. Those continue to be challenging questions, and what I would say is it's very contextually dependent. So it'll be important that it is an important tool that we can pull out of our toolkit in order to help mitigate spread in communities, in various settings. However, it'll really depend on what's going on in the community. It'll depend on, how well vaccinated the population is. And so we will, again, have to be adaptable, dynamic in our thinking about this, and just approach each situation understanding the current context and how we need to think about implementing testing as a measure for controlling infection spread in communities.
So thank you. It strikes me that when we see statistics about vaccines, that it's still, a percentage, like not a double-digit percentage for folks. And in particular, what can you say to the international inequities of vaccine administration and the consequences of that?
Yeah, so two key points that you bring up. So one is I really appreciate the Swiss cheese model that many public health folks have brought up, which is to say there are multiple layers of protection we can take. Each of those layers of protection is imperfect, but if you line up all the pieces of Swiss cheese, you have the opportunity to really prevent that risk. So going from double digits to, closer to zero. And that is our goal in healthcare when we think about healthcare safety, and that's our goal with controlling the pandemic and thinking about public health measures. So again, we have to respond to the data that's coming in to be able to understand what our response should be. Flexibility and adaptability will be key. With regard to the global situation, I am so enthusiastic that the U.S. has re-engaged with WHO and COVAX, which is a really important initiative to really think about how to address health equity. So we see substantial health inequities in the U.S., and they are even more substantial when we're thinking about access to vaccines in different countries. And COVAX is really an important program that is meant to address some of the inequities in vaccine availability, but also thinking about how we as a country can support the development of the infrastructure needed in low and middle income countries to be able to make sure that COVID vaccines are produced at the level needed to deliver it into populations globally. And I think that it's important for us to ensure that we hold ourselves accountable to not only the efficiency in which we are able to deliver vaccines, but also equity as an important principle for everything that we do. And COVID has just laid bare all the inequities that exist. So I'm hopeful that we'll continue to keep our eye on that goal going forward.
Thank you. Okay, Dr. Gengoux. After a year of sweatpants, leggings, no makeup, less stress, what is your advice for providing reentry optimism and self-esteem?
Yeah, I think the most important thing is for us to just remember our why when we're getting back together with our friends or when we're going back into the workplace, really focusing on the values that we care about, the connections we want to make, the good work that we want to do, and having a little compassion for ourselves about the past because it's easy to remember the past with sort of rose-colored glasses. It won't be so easy that way this time. But remembering that we're each doing the best we can in the moment, and as we confront our futures, just taking some inspiration from that meaning and that why.
Okay, thank you. Thank you for that. So we've heard from our experts, 4 Stanford medicine leaders throughout COVID at this time. We've just had our last question, but it won't be your only opportunity to hear from and talk to Stanford medicine faculty. Please join us for the week of May 10th for Health Matters, our week-long community health event. Be on the lookout for save the date, and you should receive an email later this month. We hope you found value in the time you spent with us today. May we all go forth today with hope, optimism for the year ahead. And most importantly, remember to be kind and patient with ourselves. Thank you. Stay safe. We look forward to seeing you at future Stanford Medicine events. Goodbye.